Okay. Okay. Well, Paul already told us a bit about the background and the development of this curriculum. And he also mentioned that at this moment we have a rather heterogeneous situation in Europe when it comes to the recognition of pediatric and adolescent gynecology. In some countries, PAC is seen as an official subspecialty, whereas in other countries it is seen as a special field of interest. And as mentioned by previous publications of Eurapag in the Journal of Pediatric and Adolescent Gynecology, if we want to create a more harmonized situation concerning PAC throughout Europe, we must strive to harmonize care. So actually the primary goal of developing this curriculum was to do just that. And obviously the healthcare situation can be improved if status of care, guidelines, curricula, and healthcare services are more homogeneous throughout an area. Let's see if we can move on to the next slide. It's also giving me a bit of difficulties. Okay, we just have to be very patient and only click once, then it should work. All right, so as Paul mentioned, APCOG created their project on achieving consensus in training, which is the APCOG Pact. This is a curriculum basically for medical trainees on their way to becoming gynecologists. So as a follow-up on this curriculum, basically for gynecologists, specialists who still want to specialize in PAC, we developed this curriculum. So it's a curriculum for postgraduates. The curriculum was developed by the board of Eurapag in cooperation with APCOG. Paul also mentioned NTOC, and we discussed with various experts in this field. The Delphi method was used to reach consensus on the decision which topics should be described in the chapters. And eventually we decided on 17 topics, which I will show you in the next slides. These chapters are all divided in either a medical or a medical surgical area, which basically means that the primary treatment is either conservative or maybe has an alternative surgical approach. And because we've divided the chapters in these two areas, the curriculum is also accessible for pediatricians to participate in this part of the curriculum. So I only clicked once, and I'm going to give it 2 seconds to see if it goes to the next slides. Yeah, there we go. Very good. So these are the abbreviations and the icons that were used in the curriculum, which I will briefly explain. So the build-up is a bit more clear. So we always start with a problem identification or patient, which you see as a PX. Then obviously we want to have a diagnosis, which we can make without performance of a specific skill, which basically means your history taking, your basic physical examinations, maybe lab, and sometimes we will need additional testing to reach diagnosis, and we will have to do that with use of a specific skill like ultrasound or hysteroscopy or anything else like that. Then the information should be given to the patient regarding the previous workup. And I'm waiting for the next slide, which will then, okay, it skipped one, but I'm gonna leave it on this slide. So and here we go back. Thank you, Mika. So then after we did our diagnosis and we gave the information of our findings to the patient, we will then see if there is an indication for treatment and whether that treatment is a medical one or a surgical one. So if we then go to the next slide, Mika, maybe you can do it. Thank you. In a graph, it looks like this. So basically we go from left to right, where we start with a patient. We do our workup to reach diagnosis, either with or without use of a specific skill. We will communicate this information to our patient. We see if there's an indication for treatment, and we determine whether that treatment should be medical or surgical. So this is the build-up, and we want the participants or the postgraduates who will follow this curriculum to stick to this workup when they see patients, and which will also make it easier to follow them in their development as subspecialists. Next slide, please. All right. So the last part of my presentation is basically 2 examples of chapters. So one example of a chapter from the medical subjects and one chapter of a surgical subject. So I've chosen to show you the normal and abnormal development of puberty. So I think we have to go 1 slide back, because this is, yes, there we go. So as you see, we start with patient presentation. We take our history. In this case, we focus on anything that has to do with the onset of puberty, obviously. And per topic, there are different aspects of history taking highlighted that the student should be aware of. So we move on with our workup, diagnosis without a specific skill, whether it's a history taking, physical examination, lab if indicated. And then we move on with diagnosis with performance of a specific skill, which in this case, we should consider vaginoscopy, maybe even examination under general anesthesia. Ultrasound might be indicated. So per topic, we indicate the different steps that should be known by our students. Obviously, the findings will have to be communicated in an age-appropriate way. Next slide. And then we consider whether or not there is an indication for treatment, which in this case, you will see first the treatment this is a medical chapter. So in this case, it's only medical treatments. All right, next slide, please. And to show you a second example, ovarian cyst and genital tract tumors, which falls under our surgical topics. Again, we start with the patient, we take the history. It's highlighted what specific things to be aware of when taking the history in such a specific patient. We move on with our diagnosis. Next slide, please. And again, with and without performance of a specific skill. Obviously, when we're talking about cyst, ultrasound and the reporting of this ultrasound plays a very important role. We want people to be aware of the differences between imaging when you use ultrasound or maybe MRI or CT, know the diagnostic value of tumor markers. And again, all the information that we find during this workup will be communicated to our patient and maybe her parents or the people that guide her. In this case, we always have to consider if we should have doctors from different specialties that need to be consulted, for instance, when it's affecting fertility. And I have the next slide. It's the one back. And again, we will see if there's an indication for treatment. There's one slide before this as well. But I think you get the point. Every chapter is built up in exactly the same order, which gives a nice overview and makes it possible to really systematically go through this curriculum. To end this part of the presentation, we have also written a manuscript about this curriculum, which will be published in the European Journal of Obstetrics and Gynaecology, hopefully before the end of the year. It's accepted, but it always takes a bit of time before it's actually published. So I'd like to give my colleague Susanna the next presentation.